Welcome to our video about toenail fungal infection. Toenail fungal infection treatment. There are many different ways to treat toenail fungus. You can choose from home remedies, topical medications, and even laser treatment. If you choose to go this route, be sure to consult a dermatologist for proper guidance. Here are some of the most common treatments. Home remedies. One of the simplest home remedies for toenail fungus is vinegar. It contains antifungal, antibacterial, and antiseptic properties. Tea tree oil is one such essential oil. You can apply this oil to your toenails and let it sit for 10 minutes. Rinse off after that. Lavender oil is another oil that may help. You can also use Epsom salt as a foot soak. You can soak your feet in this bath mixture for 30 minutes daily, but be sure to dry the area thoroughly afterward. Although homeopathic treatments do not contain harmful chemicals, they do cause side effects. Prescription medications for toenail fungus may cause gastrointestinal and liver damage. If you decide to try prescription medications, make sure to read the side effects carefully and consult with your physician or pharmacist. However, if you do find that you have a serious case of toenail fungus, you may want to consider other options. Baking soda has antifungal properties. A half cup of baking soda mixed with a tablespoon of hydrogen peroxide will help fight the fungus. You can also mix the baking soda with water and apply it to your toes. You can also soak your feet in this paste for about 10 minutes. Rinse with clean water and allow it to dry. Alternatively, you can also apply the paste directly to the infected area. A doctor can also diagnose the underlying cause of toenail fungus. Besides nail fungus, the disease can be caused by psoriasis, diabetes, and other conditions. Fungal infection can lead to amputation or hospitalization, depending on the severity of the infection. Unless you have a medical condition that puts you at risk of getting an infection, it is best to consult a doctor. Another popular home remedy for toenail fungus is vinegar. Vinegar contains antifungal properties and can be used as a foot soak. If you choose to use vinegar, be sure to dilute it with warm water to create a foot soak. This can also white vinegar as the base. You can add essential oils to the vinegar foot soak. But it is important to follow the manufacturer's instructions carefully. Oral medications. There are a few different options for treating toenail fungus. Oral medications are the most widely used for the condition. While they can be expensive, they are effective and are available over the counter at many drugstores. Among these options, Lamisil is considered to have the best side effect profile of all the treatments. The drug works by blocking the fungus' ability to breathe, killing it. However, some people are ineligible for oral medications for toenail fungus. People with chronic kidney disease or who have a compromised immune system are not advised to use these medications. People with diabetes, peripheral arterial disease, or immunodeficiency may also experience side effects. If you think that you may have toenail fungus, you should visit a healthcare provider. You can get a diagnosis for the condition based on the symptoms you're experiencing. Most healthcare providers can diagnose toenail fungus just by looking at the infected toe. However, to be absolutely sure, you may need to undergo a few tests. This way, you will know that you have a true fungal infection. Another option for toenail fungus treatment is to remove the affected nail. In some cases, the infection can be eliminated with surgical removal of the nail. While this option may provide temporary relief, it is important to note that recurrence is likely to occur if you do not treat the problem with oral medications. Surgical removal of the infected nail is recommended if the infection has been caused by trauma or infection. A nail biopsy may be required if you suspect that you have toenail fungus. A biopsy of the infected nail is sent to a lab for analysis. The sample is stained and cultured. Alternatively, it may be subjected to a process known as PCR. This procedure can identify fungal genetic material in one day. However, PCR is not widely used due to the cost and risk of false negative results. Oral medications are more effective than topical antifungal drugs. They will clear the infection faster and allow new nails to grow without the infection. This treatment is usually taken for 6 to 12 weeks and will often result in the removal of the infected part of the nail. Lamisil and Sporanox are two popular oral antifungal medications. These treatments work best in combination with topical medications. Topical medications. A doctor's diagnosis is essential for toenail fungus treatment. Various nail conditions may mimic the symptoms of toenail fungus, such as athlete's foot and post-injury changes to the nail plate. A medical professional will likely take samples of the nail for examination. If the doctor suspects a fungus, he or she may recommend a topical medicine or prescription medication. Another option for toenail fungus treatment is an oral medication. Oral antifungal drugs, like terbinafine, Lamisil, can clear the infection more quickly. However, these drugs are not always as effective, and their use may require a year or more to see results. However, they are much safer than topical medications and come with minimal risk of side effects or drug interactions. While a topical medication may be effective for the treatment of toenail fungus, it is unlikely to clear the condition. For the most part, antifungal tablets are more effective and less time-consuming. However, tablets are not recommended for some people due to side effects or other medical conditions. Discuss your options with your doctor and learn about alternative treatments. For more information, visit IQWIG. In some cases, a fungus may be hiding under a different condition. It may not be easy to distinguish between a fungus and a skin infection, but the doctor can scrape your nail and check it for signs of fungus. He or she may even send a sample of the nail to a laboratory for identification. If the diagnosis is based on these results, he or she can prescribe an appropriate treatment. In a single-center study of 22 patients with moderate to severe onychomycosis, a phenoconazole 10% solution was effective. After 24 weeks, about 50% of the patients experienced a mycologic cure. In addition, the medications had high adherence rates, and there was no evidence of relapse. The study's authors recommend using a combination of topical and oral antifungal medications for optimal treatment results. Laser treatment. If you're having problems with a toenail fungus, you may be considering laser treatment. Laser treatment is an excellent option if you want to get rid of the infection as quickly as possible. A single session usually takes 30 minutes to complete, and lasers use selective wavelengths to reduce the risk of side effects. The treatment can be very effective. Your fungal infection will resolve in 1 to 4 treatments. Your healthcare provider will create a customized treatment plan for you, based on your specific case. With this treatment, the toenail will grow back without the fungus. The laser system works to destroy the fungus by passing through the infected toenail and not damaging the surrounding skin and nail bed. It will take about 6 to 12 months to grow a new nail, but in most cases, you'll see an improvement after the first session. Laser treatment for toenail fungal infection is extremely effective and safe, and most patients will see improvement within 3 months of their first session. Traditional medication-driven treatments for toenail fungus do not work well. There are risks of liver toxicity and other complications. Laser therapy eliminates the fungus without damaging healthy tissue. Patients should also expect minimal discomfort. Laser therapy does not cause any side effects, so there are fewer risks. Further, there is no need for anesthesia or general anesthesia. Laser therapy for toenail fungal infection is a non-invasive treatment that can be done at your convenience. The Hyper-Blue Plus laser system uses specific wavelengths to destroy the fungus that's causing the infection. The wavelengths of the laser kill the fungus in the nail plate and surrounding tissues. The procedure lasts for approximately 2 months, with a return of the infection occurring after another 2 to 3 months. It is important to note that this treatment is not covered by insurance companies, as the condition is considered purely cosmetic. While no treatment method completely eliminates the infection, it can greatly reduce symptoms. One study found that half a millisecond ND-YAG laser treatment was highly effective for treating the infection. It was successful in reducing turbidity in the nail plate in 6 patients and eliminated symptoms within 6 months. A study from the University of Michigan Medical School shows that laser treatment for toenail fungus is an excellent option. Thank you for watching. Please like, comment, and subscribe if this was any helpful.